So, trying to put it in one consistent platform in a resource-constrained hospital environment makes a ton of sense for them to get good, accurate data that can help save money on that consignment inventory that's coming in every day and their spend on whether it's cardiac or orthopedic or whatever it might be. I think there's a huge opportunity for health systems. And I think, you're starting to see signs of people understanding that and trying to put the pieces together to make something that works for both sides of the equation.
Without supplies, there's no surgery. Without products, there's no patient care. Welcome to Power Supply, the healthcare supply chain podcast focused on helping you navigate the intricacies of logistics, purchasing, contracting, and supplier relationships. Each episode, we speak with healthcare executives, supply chain leaders, and innovative entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the loading dock to strategic sourcing, from buyers to the C-suite, and across the enterprise, we tackle the real-life issues impacting the healthcare supply chain. Whether you're tuning in for conversation or inspiration, we're glad you're here. You're just in time to hear it from the source and stock up on insight. So sit back and plug into Power Supply.
On this episode of Power Supply, we speak with Mickey Meehan, CEO at Green Security. Hayes, he's going to be painting a vision for vendor operations today. And I think what that means, and we're going to find out, is sort of consolidating all of these different point solutions so that, vendors, instead of having to interface with 5 or 6 different technologies as they support a health system, start to have a more consolidated kind of approach. And maybe that'll bring benefits to everybody involved in sort of streamlining things. So, Hayes, I'm interested to hear what Mickey's got to say.
It's going to be fantastic. And you need to stick around and listen to it because he does a great job talking about this vision. So stick around and listen.
All right. We're going to be right back after a short break with Mickey Meehan, CEO at Green Security.
I'm Hayes Walder.
And I'm Justin Poulin.
From the studios of Healthcare HQ, you're listening to Power Supply.
We are pleased to welcome Mickey Meehan, CEO at Green Security. He's joining us today to talk about a vision for vendor ops. So that's going to be the topic. You might not be familiar with the term. Mickey's going to tell us all about it today. Mickey, thanks for coming on the show.
Absolutely. Thanks for having me. Honored to finally be on with you guys here.
Yeah, it's going to be a rare treat, Mickey. No, I'm excited to learn about this too. This is good.
Mickey, why don't you talk about your background? Because you and Hayes actually have kind of a similar start in healthcare.
Yeah, I mean, my time in healthcare goes back to way before I was working. Both my parents were hospital administrators. So I basically grew up in a hospital, more or less at Y2K. I was in a hospital with my dad waiting to see what was going to happen, if all the systems were going to crash and all that kind of stuff. So always been around it, but my first kind of foray into it from a work perspective was as a college intern. I worked for Zimmer, a territory in Northern California, with the fun pleasure of driving trays around the entire San Francisco Bay Area and implants, whether it was lucky for me a day ahead of time or, sprinting across the bridge last minute to bring a size 5 tibia that someone had forgot to put in the bin. So that was kind of how my first healthcare job started. It sounds like, Hayes, you might have some similar experience there.
Yeah, that's funny you said that because I would work for Biomet many, many years ago. And I had that, wonderful, having to go find product, going to get loaners and going down to the bus station at 2 a.m. when you cannot get anything else delivered at that time. So yeah, I've been there and lived that life. So our med device reps, they might catch some flack sometimes, but they do a lot of work behind the scenes to make surgery happen.
Totally. Yeah. And I think even more so today, maybe with just how competitive it is, it's a whole different ballgame. You don't have much room for error. Surgeons are ready to drop you kind of, with one thing going wrong.
Exactly. Well, that's a great background.
Well, Mickey, how'd you find your way into like SaaS? You're leading a software as a service organization today. I think people typically know it as vendor credentialing, but you're gonna tell us a bigger picture vision. But how did you get to SaaS from lugging trays around for Zimmer?
Yeah, it was interesting. I actually was supposed to go audit tech companies. My background's in finance and accounting from a school perspective, so I thought I was going to go do that. And that same guy who ran the sales territory in Northern California was like, "Hey, you don't want to do that. I'll pay you more. Why don't you run operations for me? Do pricing negotiations, figure out inventory management, like all that kind of stuff." And randomly, there was this company called Mobitor that happened to be 1.5 miles away from our office in San Ramon, California. And what they were doing was like right at the advent of iPads was mobile inventory management for the medical device manufacturers. So I kind of did a handshake deal with them that said, "Hey, I'll pilot your software, but I'll do all the work. I'll install it myself. I'll set it all up, everything that's necessary." And so we did that deal. I started to set the software up at Zimmer, and not very far into that, they closed Johnson & Johnson and Stryker, and we're like, "Hey, why don't you come over, do the same thing you just did, but do it on a bigger scale for J&J and for Stryker." And then it ended up just kind of blowing up from there in terms of Integra Life Sciences, and then C-Spine and all these others over time. Yeah, that was how I kind of made the jump from being on the medical device side to then learning more about how software worked and how to build it and how to implement it and all those kind of good things that led me to where I am now.
Well, and even before that, you were with a GPO. So, I mean, you've really run the gamut here. I feel like you've been in just about every single, facet of healthcare. Yeah.
Yeah. Other than being, I grew up on the provider side, but other than not working on the provider side, pretty much every single chair possible at this point, one way or another.
We still got time. That might happen.
That's true. Plenty.
You got to be a hospital administrator and kind of bookend your story.
That's right.
So you're coming on to introduce kind of this concept of vendor ops. And I know you got a vision that you're painting there, but what does that mean to you? And maybe relate it back to your vendor experience to help contextualize the story.
Yeah. I mean, for me, coming into the vendor credentialing world, and what's actually really, really interesting is when I was at Mobitor, that medical device inventory management software platform, randomly on a contract, we built RepTrax's first mobile app for iPhone. So I got exposed to vendor credentialing on top of the inventory management piece long ago, which was, kind of full circle when I ended up at Green Security. But I think the thing that stuck out to me, even going back to those days of trying to figure out trunk stock, consignment inventory, and how you communicate between the field and the back office at the manufacturer, is nobody was looking at this whole picture from start to finish of like, what is a rep doing in their day as they interact with the hospital? And it was bad then, 15 plus years ago. And it's worse now with all the point solutions that are out there that are trying to fix all these different problems at the hospital. So if you start with vendor credentialing, then you have value analysis, then you're looking at loaner tray management for the hospital side of it. You have your own inventory management and CRM responsibilities as a rep. And then finally, you got to bill it both on the hospital side and potentially on your manufacturer side as well. So you're getting whatever you need back first AM. And so, looking at that whole picture, it's like when you think about for a hospital, how much spend is going through that continuum, it's just as important as an ERP. It's just as important as an EMR. It's just as important as a GPO and some of these other big decisions that you spend a lot of time making and implementing. And so for me, trying to stitch those things together in a way that creates, dare I use the word harmony between reps and manufacturers and hospitals, I think can be really powerful. And I think hospitals don't want to deal with point solutions. Reps and manufacturers don't want to deal with point solutions. If we can come up with something that spans kind of that whole spectrum, you can come up with something that's really powerful and, hopefully brings efficiency to healthcare overall and strip some cost out for both sides of the equation.
Mickey, it's interesting the way you kind of frame that, and you did a good job because there are so many different point solutions. But, I was thinking back 15, 16, 17 years ago, I don't know exactly the year, but at some point on the vendor credentialing space, there were literally probably 15 or 20 different companies. I mean, it was incredible to me that it seemed like every other month there's somebody popping something up. And therefore, one little area of, the country, 2 or 3 states were using one. And it was all very pocketed. But now, fortunately, we've come up to 2 or 3, 4 big ones. But I like your idea of trying to look at it as even a bigger context of putting different, solutions all together, because it's a nightmare for the systems, I think, and the vendors and the manufacturers.
Absolutely. And like the burden of integrating all those different things together, or attempting even worse to like manually move data from one to the other, it's inefficient and also error prone. So, trying to put it in one consistent platform in a resource constrained hospital environment makes a ton of sense for them to get good, accurate data that can help save money on that consignment inventory that's coming in every day, and their spend on whether it's cardiac or orthopedic or whatever it might be. I think there's a huge opportunity for health systems. And I think, you're starting to see signs of people understanding that and trying to put the pieces together to make something that works for both sides of the equation.
Is vendor ops, Mickey, kind of your overall view that other companies will play in this whole space, or is it something that maybe your company's going to be focusing on exclusively?
I think other companies have tried, and it hasn't really come together in the right way. And I think for those companies, like the focus is more kind of just grabbing land. But for us, we are focusing on it. But I think the most important thing is making sure those pieces fit together seamlessly. If we don't do that, then it doesn't help either side of the equation. It just leaves us where we are today with some of the competitors that are out there. So for us, I think we're the only ones really thinking about this term. I think we're the only ones thinking about this end-to-end kind of vision. And because I think the important thing is we talk a lot about the device reps, the pharmaceutical reps, right? But service vendors go through the same ecosystem, right? They go through, like if I'm an elevator maintenance technician, I've got to get access to the facility. I get a requisition to show up. I go do my work, and then I've got to leave and get paid, right? It's really no different. So as the number of third parties who are working in these hospitals increase, because naturally, again, if you're resource constrained, you're going to start outsourcing more. It becomes an even bigger problem for hospitals. And, when I was in the GPO, I was on the purchase services, sourcing and technology side, and it became very evident to me with the number of services in the hospitals these days, it's almost impossible for them to manage. I mean, we saw instances where they're paying bills for things that didn't happen. And so, you can use the same setup that we're talking about for device reps, use it for service reps, and now you're covering the entire third-party labor spectrum inside of a healthcare facility.
All right, Mickey, I mean, this is really interesting. And as I'm sitting here trying to think this strategy through in my head, is this something that you as an executive and a company might start to bundle these products together through acquisitions, or is it partnerships, or how do you see taking this solution or this idea to the market?
That's a great question. I mean, I think we're evaluating all of those options that you just mentioned. We did make one acquisition to add value analysis to our portfolio so that we have an integrated solution now. If you're a rep coming into the hospital or if you're bringing new products in, it's all living within one platform. And I think we'll continue to evaluate, as we move forward, whether the right strategy is to integrate, acquire, build. I mean, I think the great piece is we got team members who come from a variety of different industries. We've brought together GPO executives, medical device executives, people like me who have diverse backgrounds, people who have been in the credentialing industry for a long time. So I think, we have the capacity to build it or, acquire things and mold them into the right way that they need to be. But all the pieces are out there. It's just about stitching them together, right? And making it something that is easy for the hospital or health system to use on an everyday basis.
I feel like hospitals struggle with the compliance piece, to your point, Mickey. And I think sometimes, a part of that is because, how do the vendors view value? Right. And so I can see where pulling, all of this together to an integrated, sort of experience for the vendor rep might start to bring value to them. But, you're not just bringing value to the reps, you got to bring value to their company too. And it's kind of two different animals that or two different customers you're serving in that way, isn't it?
Yeah, I think you're thinking about it the right way. I mean, for me as a rep, and Hayes, you probably remember these days. Justin, you were a rep too, as a matter of fact. It was all about speed. How can I get things done faster, easier, and how can I sell more? So if we're helping if we can clear hurdles, clear the pathway to yes faster, I think that helps the reps individually themselves. I also think there's tons of data that probably we can be given back to the manufacturers that would help them in a variety of different ways. I think they all wonder, are the best reps spending the most time on site in the OR? Are the best reps spending more time in the clinic? And that's the kind of data we can give back to them potentially at the right time. So I do think, Justin, you're right. There are kind of two constituents on that side. I think if you build software the right way, making it easier for the rep will make the kind of assets easier for the manufacturer to use and figure out how to be a better company overall and how to work with the health system better overall.
What are some synergies that are really needed in this vein? Like now, we're kind of talking about how you get stakeholder engagement to build something for this, right? But at the end of the day, there's just a ton of talk about transparency, for the hospital and for the supplier. And it's a game of chicken, right? And a lot of days it's like, well, we can only be so transparent because we are negotiating. And so we can't give up too much leverage. But I feel like there's got to be some table stakes here in terms of what kinds of transparency. And I'm just wondering what your vision is or what your thoughts are around how to create synergies that work for all parties involved.
Man, that's a really good question. And I mean, transparency is a word that we toss around quite a bit of, making sure that the reps can see or have access to what they need to in order to do their job, to make sure that there's no surprises, whether that's credentialing or otherwise. I mean, I think, one of the first places to start with transparency is, look, vendor credentialing companies are not setting the guidelines of what you need in order to get into a healthcare facility. I mean, I think that a lot of reps don't know that. They may say, hey, why is Green Security making me do this? Or why is GHX or Simpler making me do that? Why are they different? And the answer is, it's because it's what the hospital policy is. We're just enforcing the hospital policy. So I think that's kind of the first transparent point. But beyond that, things like the schedule. I mean, I think the schedule is a perfect example. If we're bringing transparency between the rep and trust between the reps and manufacturers in the hospital, the more lead time you can give the manufacturer and the local distributorship to get equipment there, the better. Or giving them better lead time to a cancellation, the better. Right? That's being a good partner. They can divert the inventory someplace else and they're not spending tons of money to fly things overnight. And then finally on the billing side, I think, there's bill only platforms out there, but I think that's another point of transparency of how do we get the right pricing? How do we make sure that we're using a device that's approved at a facility and make sure that, everything's being checked and can just go through automatically? Because if you can get to that point, you got employees on both sides of the equation who are spending time doing nothing but checking pricing, checking that the price for the manufacturer is right and the price at the hospital is right. In other industries, that's been solved for 30 years, right? So that's something that I think, we can all collectively solve. We just got to be willing to be transparent and do it right. And you have, the manufacturer is always going to be protective of what their margins are. And I mean, I know what the margins were when I was there 15 years ago, and I know they're not what they used to be. But we also see a lot of what the hospital margins are, and in many cases negative. So there's got to be some movement to the middle and some collaboration. And I think you'll see that there's plenty to be saved for both sides, not just the hospital, and that the manufacturer's got some on the table that they can gain back too.
Yeah, Mickey, you said something about the hospitals requiring having, credentialing. Is Joint Commission part of this? That's one part of the question. Second, where are you seeing surgery centers, joint ventures? Are they requiring the same type of, credentialing as well? How is that happening?
Yeah, so it is the CMS, Joint Commission, DMV, whatever your accreditation is. It is a requirement. And there's various requirements around knowing who's in your building at a given time, what their credentials and competencies are. They vary slightly by accreditation agency. And it does kind of span everything. I mean, from acute care facility, honestly, all the way down to a clinic. There's different ways of solving it at different price points in terms of equipment required. But at the end of the day, theoretically, the health system should be tracking all of that so that they know. So it's a lot. You look at a place, like some of these mega systems now with the number of acute care facilities, the number of freestanding ER, surgery centers, whatever it is, it starts to get complicated. And so it's something that they could never do on their own. And so that's, why we as a credentialing company are trying to figure out ways to make it simpler, better, faster for both the healthcare system and the rep.
Well, if I'm a system out there, literally, should I, best practice be even at the doctor's office? If I'm a rep going into the office, should that be checked on there?
That's best practice. Absolutely. Sometimes can be hard in practice, but there's ways to solve it using mobile technology and things like that. But if you look down to the letter of every, kind of piece of the accreditation language and things like that, you would be wanting to go down to that level. And honestly, just for safety. If you look at kind of what's going on in the clinical environment right now, violence against nurses, whether it's from visitors or whoever, maybe at patients, whoever may be in the building. I think part of it is we're trying to keep the facility safe, but we're also trying to keep the visitors, patients, staff, and fellow reps safe, right? So by going through this process, even we get credentialed for going into the hospitals that we go into. And I'm assuming the other, players in the industry do that as well. It's about back to that like trust and transparency. If we're all doing it together, then we should all feel better kind of about what's going on in any given facility at any moment.
Yeah, I want to go back to something you said about purchase services and, just talking about, the scope, but also you mentioned just the breadth of, outsourcing, especially if you're resource constrained. And we've seen a total boom. That's why I think over the last 10 years, the purchase service or indirect spend as people are also kind of expanding that definition and calling it indirect spend, but it's totally blown up because the hospital is outsourcing those resources. They're saying things like, hey, you know what? We're great at the clinical work, but we're not great at housekeeping. We're not great at food services. We're not. And so more and more that stuff has been outsourced, but in what you're describing, they're just not being included in any kind of standardized screening protocol where before it had been typically sales reps and more business type vendors that were coming into the hospital.
Yeah. I think everyone thinks back to like you mentioned before, Hayes, like 15 to 20 years ago when there's those 15 different vendor credentialing organizations. And all you were thinking about was pharmaceutical and device reps, whether it was cardiac or orthopedic. So I think this new expanded definition is important because also like you probably look back 15 or 20 years, 90% of the health systems in the US had their own EVS staff. They were doing their own laundry. You know what I mean? And now it's just the opposite. Food and nutrition in tons of health systems is outsourced completely now. Same with EVS. I think when we were looking at purchase service spend, on average, there's 250 different categories to spend within a hospital that, at the time Premier considered purchase services. So, that's at least 250 different vendors, but really it's 3 to 4 per category, right? And imagine then how many people that is. And I think, as you talk to health systems, I think one of the biggest things is when you're in your supply chain office and you see somebody walking down the hall and you don't know who they are and they're not wearing identification of any kind, it's unsettling in today's world. Are you doing elevators? Are you a device rep? Are you a visitor? And so I think just with all this outsourcing, that's just become so commonplace. And it's something that has to be addressed, especially in your kind of more locked down facilities like children's facilities. It just has to happen. And it is starting to naturally occur now. It's just taking some time to get there.
I'll out myself. When I was a rep, I was managing sales and service. And so that inconsistency, we saw that because all my sales reps went through credentialing, but my service techs parked in the loading dock sometimes 4 days a week, and they never went through any kind of screening. And then they were given a hospital ID badge, and I actually had one of them get a locker at a hospital, and they weren't vetted at all, and they looked like a hospital employee. And that was actually my way in. Is I would bypass credentialing, and I would go to my service tech at the loading dock, And then we just walk into SPD, throw on a bunny suit, and nobody ever had any identification on the outside of the bunny suit. I was up in the OR talking to the peri-op director with a nice warm handoff from my service tech in about, 5 minutes from the loading dock. And so I do think there's some inconsistencies in how would somebody know if somebody was supposed to be there or not, if there's loopholes like that.
Well,
Absolutely.
But that scenario you just described about looking up and seeing, a guy or gal, people walking around, it sounds like a bad episode on Dateline now, like they show this video of this guy, he's doing some bad things to a patient or whatever. And I mean, without the proper vetting and security and protocols, that so easily could happen in some of these massive centers because they've literally got, I don't know, on a given day, they've got tens of thousands of people coming in and out of these large hospital systems. And absolutely, if somebody's doing the wrong thing and if it's not being watched, bad things could happen. So absolutely, it's needed. But I just thinking this through with all these point of contacts and all these, facilities and offices, man, that's a logistical nightmare in many cases.
Yeah. And just the sheer number of doors too. I mean, funneling people through the right spaces. I mean, some health systems have started to figure that out, and require RFID access in certain places, but that's not a standard across the country. It's different no matter where you are.
How would people know who's in their building? Like, what if, we have heard about several instances. There's actually one in my hometown in Pennsylvania where there was an active shooter event. And I think they had the NIC or the ICU on lockdown, while somebody was being held hostage, and the shooting happened when they exited the building with the local authorities. But I'm just thinking to myself, like, when that's happening, you know which employees are there that day, but how do you know who doesn't work there that's there that day? How would you account for them?
No, that's a great question. And I think that's where the value of having an interconnected platform for visitors and all the reps comes into play. Because if you can get to that point, if they don't have a visitor or a badge from a credentialing organization and they don't have a patient bracelet or an employee ID, then A, they shouldn't be there, and B, they didn't check in. So if you're tracking the entire population that's checking in one way or another, whether you're a service rep, device rep, or a visitor, and then your patient census and the employees that are there, I mean, I think that's step one. I think what's interesting is with new technology, we're looking at some new technology around Bluetooth where, like today you have to have a visitor desk or a kiosk for vendors. But if you can use Bluetooth technology to be able to just read when people are walking in or out, assuming they have all the right credentials in place or they have an appointment to visit a patient, then you get a really good picture of not only who's in the building on any given day, but who's in the building at any given moment, which I think becomes extremely powerful in a situation like you just mentioned, which today in most health systems, they just wouldn't be able to handle.
I know we're getting close to time, but I wanted to ask you one other thing that maybe kind of tees up the vendor ops piece. But I was thinking about what you were saying around transparency and even some of the billing. But one of the things that I think is a frustration for especially people working on the manufacturer side that are coming from other industries is just the lack of forecasting. Like, it seems like healthcare really struggles to forecast. And so I think it puts a lot of pressure on inventory management in general, because those demand signals are kind of last minute, or they might be sort of urgent because there was a blind spot. So I'm just thinking, like, once a demand signal is generated in a hospital, it's almost like you've got to feed it through the system to everybody involved as quickly as possible, or you're definitely at risk for case delays. And, you said bill only PO and a lot of those other point solutions. I'm just thinking, like, those are all kind of along the train of communication from at some point a case is scheduled and you figure out what you need for the case, and then you've got to get it there for the case. And, I just feel like we're under different constraints than other industries in terms of how quickly we have to react to that. So when you start looking at it that way, do you compare it to like an ERP level kind of concept? Like, should it be treated as, instead of like vendor credentialing, should it be treated like an ERP kind of system or an EMR, like in the way that it really helps hospital operations flow more smoothly with people that, the companies and the manufacturers that they work with? Because I'm not sure that those demand signals are really leveraging technology that's available today.
100%. I mean, think about this. Think about how much money hospitals spend on consultants to make sure that their OR is used to the max capacity. There's tons and tons of consultancies that are figuring out how they turn rooms faster, how they, bounce surgeons back and forth between rooms to do more cases. But if you work yourself backwards from that, if you're going to spend all of that money on that, why don't you fix the easy problems, which to your point is the communication between the vendors and the manufacturers that will help ensure that the operating room is used as much as possible. And it's something as simple as case communication, to your point on scheduling. There's not, that's not done in Epic. That's not done in Cerner. There may be special apps that are built on top of it that can help with that. But that's just one, I think, good example of where there is a huge opportunity because it is different, right? Like I mentioned, when I first started, sprinting across town with a size 5 tibia, I mean, that doesn't really happen in other industries. It happens in auto parts, but there's not a patient on the table, right? You just don't get your car for an extra day. So the criticality isn't there. And I think, that's what allows it to be kind of more lax in other industries. And so the opportunity here is there's an efficiency gain for the hospital and there's efficiency gain for the manufacturer. Nobody's really just done a great job of helping connect those two dots to get them there. And I think it's very possible. And I think we're close now with where technology is. AI is going to help too. And it's just about bringing those two populations together. And to answer your question more specifically, I think when you think about it that way, yeah, I mean, EMR, ERP, clinical quality, and this whole vendor operations concept, I personally would be spending just as much time on that implementation as I would on my ERP because there's just as much money flowing through it, this bill only world. And honestly, that's where your hospital probably makes most of their revenue anyway.
Well, Mickey, let me throw one other solution piece of that because we're talking about all those different, parts of it. There is also a patient part of that. And when I say that, there are really good companies out there, solutions that notify patients of what time they're supposed to be there. They cannot drink, they cannot eat, what to wear, the follow-up, all those things prior to surgery so that the surgery can actually happen. Just like if you don't have the implant there, you can't open them up or put them to sleep. Same thing. If they're not there, it's all dead. So to me, it's part of a whole ecosystem of solutions that truly can make the whole OR, the whole hospital kind of hum. And so that would be another piece I would add to that, I would think.
100%. I mean, at the end of the day, the whole point of healthcare is the patient, right? So, I mean, they're at the center of everything we're trying to do, everything the manufacturers are trying to do, and the providers are trying to do. And so, ultimately, they're the ones who stand to benefit the most if we can make it as seamless as possible. But that's well said, because it is, a lot of time is spent figuring out the front facing part to the patient. They don't even know what's going on in the background, right?
Well, I mean, how many times did you get ready for, you go get loaner sets, you do all this stuff, you bring all this stuff in, and you get there at 6:30 in the morning, you're all ready, and they come to find out patient didn't show. You're like, I just spent $500 on freight. And no one even, they didn't tell the patient that, or maybe they ate last night or whatever, and you're like, oh my goodness. So again, it has to be, I think it's a team effort to get them there and be a part of this. But I would just think that would be another, what's the leg of the stool that you might need.
Absolutely.
Mickey, great job today. And I like where you're headed with this vision. Anything you want to add before we wrap up?
No, I appreciate you guys bringing light to this concept. I mean, I think it's one of those things where, like I said, people have tried in the past, but I think now is kind of a critical time given where healthcare in the country is. So just excited to be able to chat with you both and hear some of your experience around it too. I enjoyed the conversation.
Thank you. It was great.
That was Mickey Meehan, CEO at Green Security, giving us a vision for vendor operations and kind of packaging, vendor credentialing up into something a lot bigger. Hayes, I like Mickey's seems like he's kind of leaning into the relationships for all the stakeholders in creating a platform for the way that, vendors, the representatives themselves, and then the supplier companies and even service organizations, as he mentioned, a lot of that purchase services and like elevator maintenance that are not typically like involved in that. I guess I always wondered about that is like, why do the sales reps who are typically going through more vetting, at least with the larger organizations, going through that process. And then you have these people that are often given hospital ID badges flowing in and out every single day, not going through any process. Like there's definitely a gap there.
Huge gap. But what I liked about what Mickey was saying was how he's theoretically trying to put a bunch of solutions together to truly bring tons of value, not only to the hospital, but also to the supplier community and everybody. It's going to make it safer, faster, better, cheaper. It's going to do a great job. I just think that thinking is the way we need to go, rather than have dozens of point solutions bringing in as truly a one large process. I thought he did a great job framing that.
Yeah, great job today, Mickey. And on behalf of Hayes and myself, to all of you out there listening, thanks for joining us for another episode of Power Supply.
Thank you for listening to this week's episode of Power Supply. As a reminder, you can help support us by subscribing on your favorite podcast app or by downloading the smartphone app on your iPhone or Android. Simply search for Power Supply in the App Store or Google Play. The best thing about downloading the smartphone app is that you can access bonus content for certain episodes and view episodes in certain categories, like articles on the go and vendor spotlights. Are you following us on LinkedIn or Facebook yet? If you are and you love an episode or post, then let your social network know about it. Like, comment, or share our posts along with your thoughts and keep the conversation going. If you have any topics or guests that you would like to recommend for a future episode, just send us an email to info@powersupplymedia.net. We look forward to hearing from you.